Hello, everybody. Hello and welcome. Let me know if you can hear me. Let me know if you can see my screen, and we will go ahead and get started with tonight's class. Can you guys hear me? Okay, thank you so much. Sorry, sometimes there's a little lag in the chat. Thank you so much. So, like I was saying, hello and welcome, most importantly, to another week of our ICD 10 CM Guideline Mastery session. I am Miss Haley. I'm going to be your lead instructor for this class, and I am accompanied by the wonderful AMCI interns, Miss Olga and Miss Vina. I'm sure you've already seen them. Welcoming everyone in the chat. They are going to be there to help you guys, encourage y'all, and help in any way that they can. So if you have any questions, definitely feel free to put those in the chat and they will get to you. And we are in week 3 already. Time is flying by. So we are going to be going over and reviewing all of our neoplasm guidelines. So just a little refresher. What is a neoplasm? So a neoplasm is defined as an abnormal growth of tissue that forms when cells grow and divide uncontrollably. So it can be classified into benign neoplasms, malignant neoplasms, precancerous neoplasms, and these neoplasms can occur in various tissues and organs, and their classification depends on their potential to spread. So as always, I will be using our ICD-10 CM book as well as our MCG manual. I will be referring to both of those the whole class, so make sure to have those handy if you can. And we will also be looking at the neoplasm table to help locate some codes. And so this table is located in your ICD-10 CM book, and it is directly after the alphabetical index, so it's going to kind of be in the front for those of you who are unsure of where it was located. And then we are also going to be keeping the same pace as last class, so we're going to do our true or false Jeopardy game followed by some of our in-depth scenarios so that we can fully master these guidelines. All right, so without further ado, I'm going to go ahead and read our copyright real quick before we get started. So ICD-10 CM Copyright 2026, American Medical Association, all rights reserved. These schedules, relative value units, conversion factors, and/or related components are not assigned by the AMA, are not part of ICD-10 CM, and the AMA is not recommending their use. The AMA does not directly or indirectly practice medicine or dispense medical services. The AMA assumes no liability for data contained or not contained. ICD-10 CM is a registered trademark of AAPC. AAPC content found within this presentation is copyright of AAPC, keyword concept FTR, Chun, AMCI Web 7, ICD-10, Flip Tap, and MCG are trademarks of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by the AAPC. AMCI does not own the rights to these credentials. The credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHEMA. AMCI does not own the rights to these credentials. All right. So that was a mouthful. All right. And then also, before we get started with our Jeopardy class, or our Jeopardy warm-up game, this is what the neoplasm table, the one that I was mentioning that is directly after the alphabetical index, this is what it's going to look like if you are in your ICD-10 CM manual. This is just like the first 2 pages, but this is how you can kind of easily identify how something is a primary malignancy, secondary malignancy, and so on. So this is definitely helpful when you are coding these type of neoplasm codes. So definitely make sure that you are acquainted with this if you are not yet so. All right, and now we are going to warm up with some Jeopardy. I'm going to stop sharing my screen and switch over to our game. Like I said, for those of you who are new, this is going to all be true or false, and I'm taking these word for word out of our MCG manual. And so if we have any questions, I'm going to be going over the exact guideline that I took all of these questions from so that we can get better practice later on down the road if you need it. So the neoplasms, this whole section is just neoplasms, so it's not all three categories. That's just going to be their label. All right. And without further ado, you're going to put your answer in the chat and let me know what you think. We'll start off with a 100 question to get us going. All right, true or false? The neoplasm table in the ICD-10-CM alphabetical index is a key reference tool for neoplasm coding. This is a good, easy one to get everyone participating in the chat. I'll give you all a few seconds to put those answers in and we will go over it. Alrighty, of course, this one is true. We were just so that was perfect timing. This is definitely a key reference tool for all of your neoplasm coding. All right, let's move to a 200. True or false? During an episode of care where a neoplasm is surgically removed and followed by chemotherapy or radiation treatment, the neoplasm code should be listed as the secondary diagnosis. So this is going to be a sequencing question. When it comes to neoplasms being surgically removed, what do we think, coders? True or false? All right, so we got a little bit of a 50-50 on this one. So this one is actually going so if you look in the guideline in the neoplasm guideline section, which again, I will reference the exact guideline where it says this, but it does say during an episode of care where a neoplasm is surgically removed, followed by chemo and radiation treatment, the neoplasm code should be listed as principal diagnosis, not the secondary diagnosis. So I just changed one little word, but if you caught it, amazing job. If not, I'm loving the participation and keep it up. I hope we learned something. That is why we are all here on this Monday. All right, let's move to a 300. When a pregnant woman has a malignant neoplasm, use a code from subcategory 09A1, so an O code. It should be first listed, followed by the appropriate malignancy code. So a lot of these neoplasm codes are going to be sequencing, so that's going to be a lot of these true or false. But what do we think when it comes to malignant neoplasm in pregnancies? How are we sequencing this? Let me know. Alrighty, this one is indeed going to be always. I won't say always, always, but pretty much always, when there needs to be an O code or there's a pregnancy in women, you should be using an O code first. And this is no exception. So that is what makes this one true. And I'm pretty sure everyone got that one right. So awesome job. Keep it up. Let's move to a 400. Okay, true or false? If more than one therapy, so like chemotherapy, immunotherapy, something like that, is administered during the same encounter, assign multiple Z51 codes in any sequence. So Z51 is going to be those codes for those therapies like chemotherapy, immunotherapy. So if more than one of those is administered during the same encounter, you assign multiple Z51 codes in any sequence. True or false? All right. So this one was kind of 50-50. This one, oop, where is my screen? Okay, this one is going to be true. So yeah, so if someone comes in and they, get a chemotherapy, immunotherapy, and a radiation therapy, you're going to code for all of those therapies that person gets. And there isn't a specific sequence that those have to be in since they're getting that treatment. Since there's no hierarchy of therapy. So you would use multiple of those codes and in any sequence. So if you got that one right, amazing job. If not, again, I will say the exact guideline where I got this one from so we can get some more practice. All right, let's go to a 300. Okay, a definition, true or false. So true or false, non-contiguous sites mean the sites do not overlap. True or false? What is the meaning of this? Let me know in the chat. All right, all right. A lot of people put true, and that would be correct. Yes, this would be what the non-contiguous sites mean. It just means that they do not overlap. So that was a good little definition. Coda wanted to throw it in there so it wasn't all sequencing questions. All right, let's go back to a 100 from the neoplasms. Oh, this one's long. Okay. So, if a primary malignancy has been excised, but additional treatment, such as further surgery, radiation therapy, or chemotherapy, is being directed at the site, primary malignancy code is no longer needed to be coded. So if they took the primary malignancy out, but it still needs additional treatment, are we still coding for that primary malignancy? True or false? Yes, I agree with Miss Vina. Definitely don't worry about if it's getting right or wrong. We're all here to learn. There is no judgment in the chat. Still give you guys a few more seconds. All right, we got a little split. So this one is going to be false. So the reason why it is false, the guidelines state that if a primary malignancy has been excised but additional treatment is being directed at the site, you are going to assign the primary malignancy code until all treatment is completed. So you would still need to be using that primary malignancy code, and that is what makes this statement false. So if you caught that one, great job. Keep it up, keep it up. All right, now we are going to do, let's do a 200. If treatment is focused on a secondary malignancy, still sequence the primary malignancy as the principal/first listed diagnosis, followed by the secondary malignancy. So again, another sequencing question. If someone comes in to get treatment specifically for a secondary malignancy, are we going to code that second and the principal first listed code primary malignancy? True or false? All right, I'm getting an overwhelming false, and that would be correct. This one is false. So yes, if a treatment is focusing on secondary malignancy, you are going to sequence the secondary malignancy as the principal or the first listed diagnosis, followed by the primary malignancy. So if you caught that one, amazing. We may or may not be using that guideline in one of our in-depth scenarios later. So I'm glad that everyone got that one right and caught that. Okay, we still got a few more to go. Let's do a 400. Okay, true or false? Do not use malignancy code if the patient is undergoing active treatment or there is evidence of disease recurrence. True or false? Are we still using this malignancy code? What are we thinking? Okay. Again, I'm getting an overwhelming false, and that would be correct. I feel like I'm picking all of the false ones. I'm not doing it on purpose. So, yes. So, you are going to retain, it says do not retain. You are going to retain the current malignancy code if the patient is undergoing active treatment or there's evidence of disease recurrence. Again, because you haven't gotten rid of it, it kind of bounces off the one that we just did about having treatment, if treatment's still being done, you're still going to code it because, the malignancy is still there. So everyone got that one right. Amazing job. Let's do a 200. Okay. True or false? When treating complications from cancer-related surgery, the cancer itself should be coded as the principal diagnosis rather than the complication. So again, another sequencing question. Let me know what you think in the chat. All right. Again, I promise I'm not doing this on purpose, but this one is going to be false. Okay. So, again, everyone got that one. I'm pretty sure. If not, hopefully we learned something. So, yes, when treating complications from cancer related surgery, the complication itself should be coded as the principal diagnosis rather than the cancer. So, in that situation, yes, you would code the complication followed by the cancer, and that is why this statement is false. So, everyone that caught that, amazing job. All right, still got a couple left. Let's do a 300. Okay, another sequencing question. When the encounter is for managing anemia associated with a malignancy and treatment is only for anemia, the malignancy is sequenced first. True or false? What do we think, coders? Let me know. Okay, so this one's listed as true. I know we were kind of 50-50 on that one. I think I'm going to have to go back and look at this one because I know when you have an encounter for dehydration in the malignancy, then you would treat the dehydration first, followed by the malignancy. So it might be the same for anemia. So I'll have to look at that one. So pause on that. and I will let you guys know on that one. I'm so sorry if I caused any confusion. I just want to make sure I got the right one. Yes, I'm definitely going to look at that one again because I think that would be false. I think it would be false. But I'll look at it again. So again, I apologize. All right, so next one. True or false? For admissions focused solely on treating dehydration caused by malignancy, the coding sequence requires dehydration code first, followed by the malignancy code. That is so funny because well, if you heard what I was just saying, then we should know the answer to that one. Yes. Yes. Okay. Yeah. I believe the previous one, it was false, and it should be, yes, anemia followed by that. So now we are going to focus on dehydration. So this is a dehydration sequencing question. So let me know if we think this statement is true or false. Okay, yes, and indeed, this is true. So yes, if someone is coming in with dehydration caused by malignancy, you are going to code the dehydration first, followed by malignancy codes. And again, this might be used on an in-depth scenario later, so definitely keep that in mind. And our last question for this warm-up game. Okay, when the focus of treatment during an encounter is the neoplasm that is associated with a pathologic fracture, the neoplasm is sequenced first. All right, so one last sequencing question. Let me know if we think this is true or false in the chat, and then we will move on to our in-depth scenarios. Okay, indeed. This is an overwhelming response of true, and this one is going to be true. So yes, you're going to sequence a neoplasm first when someone is coming in for treatment of neoplasm associated with a pathologic fracture. So great job. Way to end that game on a high note. Everyone got that one right. I'm going to stop sharing my screen for just a second. And like I was saying, I'm going to quickly just click through all of the guideline references that I used for this game so that if you need to look back on this video, because it is going to be recorded and it is going to be on the YouTube live section page. So you can always look back on it, and if you need to pause and look at the specific guidelines, definitely do that. So this is going to be our first section. So this is all the questions, all of the answers, and then the specific guideline that I used. Again, I will go back and change that anemia question, so ignore this one right here because this one is going to be false. This is the right guideline, but it's supposed to be false. All right, this is the second column that we did, the question, the answer, the guideline. And then this is going to be the third column. Again, the question, the answer, and the specific guideline. These are all the guidelines that I took out of the MCG manual. So if you need to look back on those to get some extra practice, please do so. All right. And I hope that you guys are feeling confident because you did amazing in that warm-up game. You caught a lot of the kind of sneaky questions I was trying to sneak in there. So amazing job. And now we are going to move into some in-depth scenarios. So I'm going to stop sharing my screen one more time and I'm going to grab our Quizlet. So for those of you who are new, if this is your first class, we're going to have a scenario and we are going to break it down into 3 different sections. So we are going to break it down first into keywords, and then we are going to break it down into the guideline we're going to be using to find the codes. And then lastly, we are going to find our ICD-10 CM codes. So we are just going to break down one scenario completely so we can fully understand how to break down a scenario when we see it. Okay, so our first scenario is going to be a 63-year-old woman is admitted to the hospital to remove a malignant neoplasm of the upper lobe of the right lung. The surgery is completed successfully. During the same hospitalization, the oncologist initiates adjunctive, oh my gosh, I cannot talk, adjuvant immunotherapy to reduce the risk of recurrence. So what keywords are we taking out of this encounter? We're not going to be doing the guideline or the other codes just yet. We're just picking out the keywords that we need to focus on that are going to help us pick out the guideline and then help us pick out those codes. So let me know in the chat what we think those keywords are, and then we will go over it. Okay, if you are still typing those keywords, definitely continue to do so. The ones that I'm taking out are going to be the malignant neoplasm of the upper lobe of the right lung, same hospitalization, so everything being done during the same hospital stay, and the immunotherapy. So if you put anything like that on in the chat, great job. Now we are going to be using the same scenario, but we are going to pick our guidelines. So you can either put the title or the whole title or like the number of the guideline that we're going to be using. Obviously, the guideline is going to be within the neoplasm guideline section, so we can narrow it down a little bit. Oop, oopsies. And what guideline are we thinking? And we will go over it in just a sec. All right, so the guideline we are going to be using for this scenario is going to be IC2E1. And the title of this guideline is going to be Admissions/Encounters Involving Chemotherapy, Immunotherapy, and Radiation Therapy, specifically episode of care involved surgical removal of neoplasm. So if you got that right, I see a few people put that in the chat. So absolutely outstanding. I know sometimes finding the exact guideline is a little difficult. So if you got that one, great job if you're on the right track. All right, and then now we are going to use that guideline and we are going to use those keywords and we are going to put it all together and we are going to pick out our ICD-10 CM codes. So I will give you guys a few seconds on this one and then we will go over to our PowerPoint and we will see how everything looks all together. So let me know in the chat and I'll give you guys a little bit of time. All right, if you are still working, please continue to do so. I am just going to switch over to our PowerPoint. I will not give away the answer just yet. All righty. So here is the scenario. I won't read it again, but our keywords that we're taking out of there, again, are going to be the malignant neoplasm of upper lobe of the right lung, same hospitalization, and that immunotherapy. And then this is going to be the guideline we are going to be using. Again, IC2E1, which a lot of you guys put in the chat. So again, always super helpful when you're looking at the MCG manual specifically because you have the sequencing suggestion right here on the right side. So it does say the reason for encounter the neoplasm surgery followed by chemo or radiation or immunotherapy would be the first, you would code your malignancy, and then the second would be followed by a code from Z51, which would be the therapy, that immunotherapy, chemotherapy. So first, we have our first code right here, which is going to be the malignancy. So specifically, we are going to select code C34.11, which is going to be malignant neoplasm of upper lobe, right bronchus or lung, because again, the keywords that we're taking out, malignant neoplasm of upper lobe of the right lung. So that would be the correct malignancy code. And then we are going to follow it up by our therapy code. And another keyword that we took out of our scenario is going to be that immunotherapy. So that is going to lead us to our second code in this scenario, which is specifically going to be Z51.12. So encounter for anti-neoplastic immunotherapy. So that is how we came up with these two codes, which a lot of people put in the chat, or a lot of people were on the right track. So I really appreciate the participation. I feel like that was a great first scenario. So hopefully, if we had any questions, hopefully that explanation made sense, but you guys are doing amazing from what I can tell in the chat. So outstanding job. All right, and we are going to switch back over and we are going to go and do our second scenario. It is going to be the same flow. So now we're kind of getting the hang of it. All right, let's see what we got. Okay, So, a 58-year-old man with a metastatic prostate cancer is admitted to the outpatient infusion center for chemotherapy treatment. The purpose of the visit is the administration of anti-neoplastic chemotherapy. During the infusion, the patient develops nausea and vomiting secondary to the chemotherapy, which is treated with medication and the chemotherapy is completed. So, what ICD 10 CM keywords describe this encounter? I know this is a long one, so I'll give you guys a few seconds to type out those keywords. Let me know in the chat. All right, I'm getting some answers in the chat. So, yes, so what I'm taking out of here is going to be that prostate cancer or the metastatic prostate cancer. The purpose of the visit is for that anti neoplastic chemotherapy and nausea and vomiting, most importantly, being secondary to the chemotherapy. So everyone kind of put the same along the same lines in the chat. So great start. And our second part of this scenario now, we are going to select what ICD-10 CM guideline is going to best describe this encounter. Again, obviously it's going to be within that neoplasm guideline section to kind of narrow it down. So let me know in the chat what we think it is, and then we will go over it. All right, getting a lot of great responses in the chat. So, yes, so the guideline that we are going to be using is going to be IC2E3, admission/encounters involving chemotherapy, immunotherapy, and radiation therapy, specifically patient admitted for radiation therapy, chemotherapy, or immunotherapy and develops complications. So now we are going to move on to our third and final part of this scenario. We're going to use, again, those keywords and that guideline, and we are going to pick what ICD-10 CM code or codes best describe this encounter. Again, I'll give you guys some time, and then we'll switch it over to our PowerPoint to see how everything looks all together. All right, no worries if you are still working on it. Again, I'm just going to switch over to our PowerPoint. Well, maybe. Let's see. Okay. Alrighty. So again, not this one. This is going to be our scenario. So the keywords we are taking out of this scenario are going to be that prostate cancer. Purpose of the visit is going to be for that anti-neoplastic chemotherapy, and the nausea and vomiting secondary to chemotherapy. So this is going to be the guideline that we are going to be seeing in the scenario. This is what we're going to be taking out of it. So again, super helpful in the MCG manual. It kind of has a sequencing suggestion right here. So our first code suggestion is going to be for that therapy code, and that kind of is backed up by saying in the scenario that the purpose of the visit is for the chemotherapy. So the code that we're going to pick first is going to indeed be for the therapy. So we are going to select Z51.11 as our first code, which is going to be the encounter for that anti-neoplastic chemotherapy. And then if you go back to the guideline, we have our second coding sequencing suggestion, which is going to be coding for the complication. It even gives us an example of what a complication could be: nausea and dehydration. And if we look back at our keywords, nausea and vomiting are going to be that complication that we're going to be having. So that leads us to our second code, which is going to be R11.2. And that code is going to be nausea with vomiting unspecified. And so that codes for our complication. And then those are going to be the two codes we are going to be using. So if you guys got that one right, amazing job. I'm pretty sure everyone got that one right. So great job. Outstanding. And hopefully this made sense. If not, I know I didn't say it in the beginning, but Miss Olga has been posting she has been posting the link if you need to ask any questions, the survey link. So if you need to ask any questions about anything that has gone on. Oh, I am having a day. A lot of people were probably like, where is the code for the malignancy? So yes, so since again, the prostate cancer, I'm so sorry. So yes, we still have to code for the malignancy for the prostate. So we are also going to include C61, because that is going to, since it's been said in the scenario, they've specifically said prostate cancer, we should be coding for that. So that's why this code needs to be included. I almost forgot about that. I'm so sorry. So yes, so these are going to be our three codes, because you definitely need a code for the prostate cancer since it was listed. And that was even a keyword that we took out of this scenario. So yes, these are going to be the three codes. And again, if you have any questions, yes, thank you, Miss Olga. She posted the survey link. So if you want me to go in more depth on any of these scenarios, click on that link. You can ask the question and I will get back to you with an answer. All right. So now I'm going to stop sharing and we are going to grab the last scenario of the night. Let's end on a good one. Everyone has been doing amazing on these so far. Even picking out the guidelines. I know sometimes that's a little difficult, but especially Becky. Shout out Becky in the chat. She is killing it with that guideline, finding those guidelines. All right. So our last scenario of the night, again, we are going to go back to picking out the key words. So a 72-year-old man with malignant neoplasm of the lung and secondary malignant neoplasm of the brain presents to the oncology clinic for a scheduled chemotherapy infusion for the secondary malignancy. Upon evaluation, the oncologist determines the patient is severely dehydrated and the chemotherapy is canceled for today's visit. The patient instead receives intravenous hydration in the office, and the chemotherapy is scheduled for a later date. All right, I know that was a long scenario, but we are going to shorten it by picking out those keywords that best describe the encounter. Let me know what you think those are in the chat and we will go over it. Okay, if you're still typing away, I know there was a lot of keywords, so definitely continue typing, put those in the chat. But the keywords I'm taking out of here are going to be the primary malignancy, the neoplasm of the lung, secondary neoplasm of the brain, and the chemotherapy canceled due to dehydration, and then the chemotherapy being rescheduled. So those are the ones that I'm taking out of there. And now we are going to move on to the guideline. There actually is going to be two guidelines from the neoplasm section being used in this scenario. So if you know both of them, if you know one of them, put it in the chat and then we will go over it. All right, so the two guidelines we're going to be using are going to be IC2C3, which is coding and sequencing of complications, management of dehydration due to the malignancy, and also guideline IC2B, which is going to be admission/encounter for treatment of the secondary site. So if you got one or both of those, amazing job. And now, last but not least, we're going to use that guideline and those keywords, and we are going to be selecting our ICD-10-CM codes that are best going to describe this encounter. And as always, I will give you guys a little bit of time, and then we'll move over one final time to our PowerPoint and see how everything looks all put together. Alrighty, I am going to switch over to our PowerPoint one more time, but please keep working if you are working. Okay. So this is going to be our scenario. So like I said, the keywords we are taking out of here are going to be that malignant neoplasm of the lung or the primary malignancy, the secondary neoplasm of the brain, and the chemotherapy canceled due to dehydration or the chemotherapy being rescheduled. I also would like to point out another keyword that I should have added in here is going to be that the chemotherapy was scheduled specifically for the secondary malignancy. So the secondary malignancy is what was being treated. So that is important in here as well, and you will see why in just a second. So this is going to be our first scenario. We are going to be focusing on specifically management of dehydration due to malignancy, and then also our treatment for secondary site. Again, the reason that I said that that keyword addition is because they were here, the patient was here to receive treatment of the secondary site because it says scheduled chemotherapy for the secondary malignancy. So that is why we also have selected this guideline. So, but we're going to focus on this guideline right here. So the dehydration due to malignancy, again, if you look in our sequencing suggestion right here on the right-hand side, and what we were going over in our true or false Jeopardy questions, we are going to sequence that dehydration first. So that is going to be our first code, our E86.0, which is the code for dehydration. And then right here, it says to code for the malignancy. And since the secondary malignancy is what was being treated, we are going to code the secondary malignancy first, and we're going to refer to this second guideline right here. So we're going to code the secondary malignancy, which is going to be C79.31. Because again, looking at our keywords, the secondary malignancy or the secondary neoplasm is going to be of the brain. So that is going to be our second code, and then we are going to follow that by the code for the primary malignancy. Again, looking at the keywords, that is going to be the neoplasm of the lung. So that puts us right here to our third code, which is going to be C34.90, which is malignant neoplasm of unspecified part of unspecified bronchus or lung. And again, if you look down here, it just says lung cancer not otherwise specified. So that is why we are selecting that code right there, and it also requires us to use 5 characters. So that is why we selected all 3 of those codes. So if you got that one right, or if you were on the right track, absolutely amazing. I know this was a super long, intricate scenario, but that is why I picked it, because if we can look at scenarios like this and we can break it down into the components of keywords, guidelines, and then our codes, then being able to go on that coding exam and choosing between multiple choice questions, that should be easy breezy, and we'll be able to save some time hopefully on that, because I know everyone is looking for more time when they're taking those certification exams. But again, I will say it again, if we have any questions that we may have about any of the scenarios we went over or any material at all in our class today, Miss Olga was super kind and put the survey link again in the chat. So definitely make sure to click on that, or just give us feedback on how we're doing in the class so that we can better help you guys learn and pass those certification exams. And we really appreciate that. Make sure to give this video a like. And then next week, we're going to be on our week 4. We're going to be meeting here, same time, 7 p.m. Eastern Standard Time. I hope to see everyone there. Thank you guys so much. Thank you so much to my team, Miss Olga and Miss Vina, for being absolute rock stars, as always, for these classes. Thank you guys for taking time out of your Mondays to join us, and we hope to see you next week. You guys have a wonderful rest of your day.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all